Hello, I'm Dr. Tom Toothaker. I'm a physical therapist and physical therapy director at the Orthopedic and Spine Center. Welcome to Joint Ventures, an OSC original podcast where we take a look at recent news and headlines, bringing you the facts you need to make best decisions about your healthcare. Today, we're going to discuss an exciting technology coming to OSC within the next few weeks. This technology is called StemWave. StemWave is a form of regenerative medicine. It uses shock waves that penetrate deep into the tissue that work on the cellular level to decrease inflammation and pain, improve function, and shorten healing time frames. Joining us today is Dr. Brianna Vesely. Dr. Vesely has first-hand experience using StemWave in clinical practice. Dr. Vesely, first tell us who you are, some of your background, and how you were introduced to StemWave.
Hi, everyone. I'm Dr. Brianna Vesely. I'm the foot and ankle specialist at Orthopedic and Spine Center. Although I'm a surgeon and I did advanced fellowship in surgical interventions, if someone can avoid foot surgery, that's always preferable. As y'all have probably heard, all surgery, especially foot and ankle surgery, can always have lots of risks and complications. Therefore, I always exhaust conservative treatment for my patients before recommending surgery. So I started practicing here about a year ago. Before coming here, I practiced in Vegas with high-level athletes such as NFL players, WNBA, and Cirque du Soleil people. And in my practice there, we actually had a StemWave device. So when I came here, I reached out to Dr. Toothaker and asked if he knew of a StemWave device in our area, but sadly we didn't.
In fact, we have the only unit in all of the Hampton Roads area. When Dr. Vesely told me about this technology and the remarkable results she had experienced, I decided to study the technology and do a deep dive into the research. Now, I've used many forms of modalities: therapeutic ultrasound, laser, percussion therapy, multiple forms of electrical stimulation, and dry needling. In general, I'm pretty skeptical when it comes to all forms of technology, tools, and devices. With the exception of dry needling, I haven't been too impressed with any of them. Now, they all have their place and have helped patients, but nothing seems to compare to what we are going to discuss in regards to StemWave. Okay, so how does StemWave actually work? It begins with a spark in water that creates a focused acoustic shock wave that travels at 1,500 meters per second. That's 5 times faster than the speed of sound. The mechanical energy from this shock wave produces a regenerative effect on the cellular level. There are 5 primary biochemical changes that occur producing the regenerative effects. We're going to discuss 3 of them briefly. 1, voltage-gated sodium channels release chemicals that cause pain and inflammation. StemWave shuts down these pathways, leading to an immediate reduction in pain and inflammation. Number 2, pro and anti-inflammatory cytokine regulation. When there is damage to the body, inflammation occurs to begin the healing process. This process can take quite a long time, and inflammation is a pain generator. StemWave significantly reduces the time spent in the inflammatory period and quickly initiates the immune response for healing. Number 3, stem cell proliferation. When certain cells are damaged from trauma, they leak mRNA, which triggers other cells to begin stem cell proliferation. Why are stem cells important? Stem cells turn into whatever cells they're signaled to turn into, such as muscle cells, nerve cells, etc., and regenerate tissue. The shock waves slightly deform the cell, tricking it into thinking damage has occurred, which triggers the cell to leak mRNA, leading to stem cell proliferation. It also promotes angiogenesis, which means it provides a new blood supply to the damaged tissue. Dr. Vesely, can you give us some examples of conditions and results that you've witnessed with StemWave technology?
Yeah, definitely. So as a foot and ankle doctor, I've used it for a wide variety of conditions, ranging from plantar fasciitis that just won't go away despite PT and stretching, tendinitis, and even bone healing problems. And literature actually supports it. So not to get too nerdy, but here are a few studies. So for non-insertional Achilles tendonitis, meaning it's not where the Achilles inserts on the heel, but more proximal, we always start with stretching, anti-inflammatories, physical therapy, etc. So Feeney et al. Did a literature review, and they looked at multiple studies to draw broad conclusions. They found 283 articles that concluded that this modality reduced pain as well as improving function. So while lots of literature is out there supporting it for tendons, there's actually literature to support bone healing. The Journal of Clinical Medicine in 2022 looked at using this technology for long bone non-unions. A non-union is when the bone doesn't heal like it should. They found that 73% of bones healed, and metatarsal bones, which are the long bones in the foot, were susceptible at a 90% healing rate.
Yeah, there is a significant amount of literature out there on shockwave therapy. It is shown to be effective in treating a variety of musculoskeletal conditions, nerve-related pathology, peripheral neuropathy, and osteoarthritis. It is also very effective in treating non-union fractures that are not healing appropriately, and significantly enhancing the rate of healing of post-surgical procedures. Let's look at a few more studies. Yon et al. Conducted a randomized controlled study comparing shockwave therapy to NSAIDs and hyaluronic acid on 45 patients with early osteoarthritis of the knees. Shockwave therapy was given 2 times a week for 3 weeks, and NSAIDs using Celebrex at 200 milligrams was given daily for 3 weeks, and hyaluronic acid injections were given 1 time a week for 3 weeks. Shockwave therapy demonstrated improved pain relief and functional scores over NSAIDs and hyaluronic acid injections. And check this out. They also showed an increase in bone mineral density in the proximal tibia in the shockwave therapy group. One more study. Tao Wu et al. Conducted a meta-analysis in the efficacy of shockwave therapy in the treatment of myofascial pain syndrome. 8 randomized controlled studies with a total of 571 patients met the inclusion criteria. Shockwave therapy was found to be very effective in reducing pain and increasing the pain threshold.
I personally have used it on patients, including high-demand NFL and WNBA players, for non-unions of bones, neuromas, tendinitis, and plantar fasciitis of the foot and ankle. I'm super excited we're bringing it to Newport News. It's an overall pretty quick treatment that's low risk for patients to do that have failed other methods such as NSAIDs, injections, physical therapy, and immobilization.
So this is anecdotal, but I recently attended a StemWave in-training seminar. So in this seminar, we had MDs, chiropractors, and physical therapists. So one MD had a known rotator cuff tear. He could only raise his arm to about here, 90 degrees. 6 minutes later, after the StemWave treatment, he could raise his arm to about here, about 150 degrees, and reported an 80% decrease in his symptoms. Next person, another class attendee came up there. She had significant pain in both of her knees. She could squat to about 45 degrees, and she had a significant increase in pain. She had StemWave treatment, about 6 minutes each knee, was able to then squat to about 75 degrees and also reported an 80% decrease in pain, okay? So I'm really skeptical about these things. So I raised my hand. I was the next contestant. I went up there. I just recently strained my lower back the other day. I was on the table, and they did the StemWave treatment, got off. I had a 50% decrease in symptoms. Now, the instructor stated that though these results can occur, they're not typical. There's typically a 10 to 30% improvement in symptoms following the first session. Now, some of you may be saying right now, but Tom, I've had this done to me at my chiropractor's office or in physical therapy. It's most likely you experienced something else. There are devices that produce different types of waveforms which can be beneficial depending on the issue, but there is only one true shockwave that has proven regenerative effects. So we will begin scheduling patients for StemWave therapy in the next 2 weeks. This is not covered by insurance and is a self-pay service, but from everything I've witnessed, it's worth every penny. So on your first visit, we'll conduct a thorough evaluation to determine if you're a good candidate for StemWave therapy. From there, we will design a plan that is specific to your needs. Well, Dr. Vesely, anything else to add?
Yeah, I'm super excited that we're bringing it and that, we'll be the only facility carrying it in Hampton Roads. So I'm looking forward to seeing all the improvements in both of our patients.
I agree. Well, that's it for now. Check back soon for our next Joint Ventures podcast.
At Orthopedic and Spine Center, we're dedicated to providing the highest quality treatment using the most advanced technology available. Our fellowship-trained spine and interventional pain management physicians specialize in diagnosing painful conditions and offer minimally invasive interventions to complex spine surgeries. Our pain psychologist helps patients understand and reduce stress from chronic pain conditions. Our experienced physicians get you back to doing what you love. Call today for an appointment. Experience excellence at Orthopedic and Spine Center.